Okay, let's start with the discussion of the gastric analysis. Then let's start with the gastric juice first. Let's discuss the gastric juice, which is there are yellowish or grayish watery fluid with low specific gravity secreted by the surface epithelium gastric cells and various glands of the gastric tract. So the pH level of the stomach is that the stomach resting pH level is about 4 or 5. After a high protein meal, the stomach pH level may drop to 1 or 2. So what are the 7 major functions of a stomach acids? They sterilize the food, they protein digestion, activating pepsin, activating intrinsic factor, stimulating the delivery of bile and enzyme, and closing the esophageal sphincter and opening the pyloric sphincter. So what is Zollinger-Ellison syndrome? These are parang kuan siya kaning tumor ni siya sa pancreas na makikita sa body of the pancreas, tall or head sa pancreas. So mo na siya an example for the Zollinger-Ellison syndrome is that ang tumor of pancreas is na gastrinomas na siya, which na mga burot-burot na. So, ang Zollinger-Ellison syndrome, ano siya may tabo ni? Ang non-beta islet cells of islet of Langerhans, ang gastrin is that the gastrin secreting tumor, which equals to the parietal cell, then the hydrochloric acid, ang hydrochloric acid mo agto din sa body of the stomach, so which cause the ulcer formation. So, ang clinical ani is that there are abdominal pain, chronic diarrhea, dyspepsia, weight loss, and gastrointestinal bleeding. As kora po ni siya sa men po ni usually ang Zollinger-Ellison syndrome. So, let's discuss the digestive disorder, which we have first the gastric acidity. The anacidity refers to the failure of the stomach acidity to fall lower than 6.0 in a stimulation test. Napuntay hypochlorhydria, which refers to the physiologic failure of pH to fall below 3.5 although it decreased to pH 1.0 unit or more upon gastric stimulation. We have the achlorhydria, which is the physiologic failure of pH to fall below 3.5 or 1.0 pH with gastric stimulation na. So here is the peptic ulcer disease, which the peptic ulcer disease can form in the stomach, which it can form in the esophagus, it can form in the fundus, it can form in the body, it can form in the can form in the polychromic. Yeah. Polychromic. So, yeah. So, sa Zollinger-Ellison tumor in pancreas, it becomes na siya, bukol-bukol na siya. The duodenum ulcer due to hyperacidity, magkakampog ulcer po ang duodenum, which they are the one who receive the bile of the stomach, which can cause damages also. Then, mali siya. So, the peptic ulcer is nasa sa esophagus deform, which ang tawagan nila is esophageal ulcer. Kung sa stomach naman deform, it is called a gastric ulcer, and kung sa small intestine naman deform, it is called duodenal ulcer. So, ang sa mga ulcer, ang pagkuha na siya it's either by burning or by cutting the cell in order to remove the bad cells in the stomach. So, here's the duodenal ulcer, which D or stands for DU for its acronym. Na siya mga buslot, mga kuan. Well, ang gastric ulcer naman is siya buslot pero murag loas. Now, let's talk with the gastric analysis by physiology of gastric secretion and digestion. So, the physiologic function of stomach is that it acts as an expandable reservoir for ingested food. It is the initiation of protein digestion by pepsin occurs in stomach. The gastric mucosa secretes intrinsic factor for binding and absorption of vitamin B12 in the ileum. So what are the three major cell types responsible for the production of gastric fluids? So the three main cell types responsible for the production of gastric fluids is that the chief or peptic cells, which they are produces protein splitting enzyme. We have the parietal or oocytic cells, which produces hydrochloric HCl and intrinsic factor, which is the erythropoietic factor, absence of which lead to pernicious anemia. Then we have the goblet or mucus secreting cells, which they are the producing mucus to protect the mucosa and lubricates the food. Now let's discuss the general phase of gastric secretion. In the phase of digestion, we have the cephalic phase, which they are the one who stimulates the vagus nerves or in the gastric secretion even before food is swallowed. Why? More like kanang naglaway-laway na sila, para nag-ready na sila or unsa pa diha. While the gastric phase naman is the food stretches the stomach and activates menteric and vagovalve reflexes. This reflex stimulates gastric secretion, then histamine and gastrin, and also stimulates acid and enzyme secretion. So mao ni siya ang sa gastric phase naman nanay mga food ani gastrin ug histamine gikuan ang food show menteric reflexes para ikuan ang food. So the intestinal phase naman is that intestine gastrin briefly stimulates the stomach, but then secreting GUP, CCK, and undergo gastric reflexes. Even gastric secretion and enzyme already in its sympathetic nerve fibers suppress gastric activity, while vagal parasympathetic stimulation of the stomach is inhibited. So pagawas na din ang sa intestinal phases na siya. So let's discuss the detail of the cephalic neurogenic phase, which involves vagal nerve stimulation caused by the stimuli such as taste, smell, or sight. Anticipation of food hunger response has four effects on stomach. Let's start with the gastrin, which is secreted into the blood by specialized G cell in pyloric gland and stomach, and by the delta cells of the parietal cells. Then we have the hydrochloric acid, which they are the gastrin causes secretion of hydrochloric by parietal cells of the gastric cells of the proximal body and fundus, and the secretion of pepsin by parietal cells. Then we have the vagal excitation, which is lower the threshold of parietal cell to gastrin stimulation. And last but not the least, we have the gastric peristalsis, which is the emptying is promoted. So yeah, so the cephalic phase naman, so ang function niya is that ang taste, smell, or thought of food chemoreceptors, tactile sensation in mouth, is gikan siya sa hypothalamus, moadto siya sa medulla oblongata, magkuana siya mag-send og signals, tapos moadto sa vagus nerves, pag-adto sa vagus nerves na pod, moadto din na siya sa musecretes din ang kuan dahil musecretes og histamine, gastrin o secretions is stimulated na siya by the circulation sa stomach. So, the cephalic phase naman, the taste and smell or thought of food or tactile sensation of food in the mouth stimulates the medulla oblongata, which the green arrow, which the vagus nerve carries parasympathetic action potential to the stomach, pink arrow, where enteric plexus neurons are activated, while the next steps is that postganglionic neuron stimulates secretion by parietal and sheep cells and stimulates gastrin and histamine secretion by endocrine cells, which the gastrin is carried through the circulation back to the stomach, the purple arrow, where along with histamine it stimulates the secretion. Now let's discuss the gastric phase, which involved gastric distension and continued gastric secretion of digestive juice, which the cephalic via vagus, siya ang makita sa cephalic via vagus. The vagal centers of medulla, moagto siya sa afferent fibers, then goes to the vagus trunks, which it has the gastric phases na, which is in the stomach. Then the stomach, it consists of local nerve plexus and gastrines, which the gastric spaces is the local nervosecretory reflexes, the vagal reflexes, and the gastrointestinal stimulation. So mag-stimulate siya histamine kuan, tapos magkuan siya vagal reflexes and the local nervosecretory reflexes. So parang naglihok siya. Then ang circulatory system is na po sa stomach, nag-produce of histamine and gastrin. So in the intestinal phase naman, it caused by the nervous mechanism and hormonal mechanism, which ang intestinal phase naman is the small bowel actually. So let's discuss more in detail on the intestinal phase, which it involves digestion in the small intestine. Secretion of gastrin by G cells is inhibited by gastric inhibitory polypeptide or GIP, which secreted in the duodenal gland in the small intestines. Gastrin secretion is reduced at pH of less than 3.0, less than or equal 3.0, and stop completely at pH of less than 1.5 when key cells located in the distal duodenum and proximal jejunum comes in contact with fat, glucose, or amino acid, and gastric GIP is produced. So what are the major digestive enzyme? We have the enzyme, we have the carbohydrates digestion, which we have the salivary amylase, which produced in salivary gland, and its sites of release is in the mouth and their pH level is neutral. The pancreatic amylase is produced by the pancreas, which sites of release is in the small intestine and their pH level is basic. With at the same time as the maltase, each produced in the small intestine, there are site of release is the small intestine, which their pH level is basic also. In the protein digestion naman, the pepsin, which produced in the gastric glands, which their site of release is in the stomach, which their pH level is acidic. The trypsin naman is produce siya sa pancreas, which yung site of release is nasa small intestines, which their pH level is basic. 50 doses pod is giproduce na siya sa small intestine, tapos sa site of release is in the small intestine, their pH level is basic. Now let's go with the nucleic acid digestion, which let's start with the nuclease, which a nuclease is produced na siya sa pancreas, site of release is in the small intestine, and their pH level is basic. At the same time, the nucleosidase is the same of the nuclease, the fat digestion. Okay. Now let's go with the cell type. Actually, the parietal cell, which is located in the body, and its secretion is from the hydrochloric intrinsic factor. Then we have the chip cells, which the location in the body, in the stomach niya, which is the secretion is in the pepsinogen. Then we have G cells, which is location in the atrum, which its secretion is gastrin, and mucous cells, which is location in the atrum also, which it secretes mucous pepsinogen. So makita man siya ninyo na chip cell nasa nag-release of pepsinogen, a parietal cell po nag-release po o intrinsic factor of HCl, while ang G cells naman, where's the G cells? Okay, the G cells naman is nag-secrete siya pagpagawa sa gastrin naman, pagawas na siya sa stomach, while ang mucous cell naman is pasulod niya po nag-secrete siya og mucus or the mucous pepsinogen. So let's start with the gastric fluid composition. We have the H2O, which varying amount, which kasagaran yung amount ni siya, which 99% ni siya. We have the hydrochloric acid, which secreted by the parietal cell and fundus of stomach, which provide acidity for the activation of pepsinogen. We have the hydrochloric function to convert pepsinogen to pepsin and to hydrolyze polypeptides and disaccharides. Then we have the digested enzyme, which we have the pepsin, which catalyze the protein digestion to proteolysis or proteolysis at pH 1.6 to 3.6, secreted by chief peptic cells. Then we have the lipase naman, which is there are fat which has no importance to digestion. We have renin naman, which there are milk, the ability to coagulate carcinogen to milk. Then we have the gastricin naman, which is important, not yet known in the gastric secretion naman. Now let's start with the discussion of the gastric fluid composition. We have the mineral acid, which are the chiefly acid phosphatase. We have the mucus, which found in moderate amount secreted by the goblet cells of stomach to prevent autodigestion of stomach. Then we have the electrolytes, which their main is H+, other are sodium, chloride, calcium, potassium, and magnesium. Then we have the particle of food, which is the undigested and partly digested. So let's start with the type of gastric juice collection, which use of evacuated tube. We have the Levide tube, which is in the nasal intubation. Then we have Refus tube, which is oral intubation. The tubeless gastric analysis, a non-invasive method to determine gastric acidity. Then we have the Dianix blue, which they are carboxylic acid, cationic resin with an indicator diazure A coupled to it and given to patient orally. Then we have the hydrogen ion in gastric secretion, which combines with the resin and release the azure A ions, which are absorbed into the bloodstream in the small intestine and excreted in the urine. While our Refus tube, which kani makita ni siya kani sa baba ibutang ni tapos mag-extract din sila og mga gastric juice para mailhan nila kung unsay color sa gastric juice or unsay kuan. So they are either be disposable, it kanang mga latex or mga plastic, or it can be reused like the glass naman po mga ma-reuse. Then we have the nasogastric feeding. Ang kuha na siya kanang mga unconscious na mga patient diha na ibahog na ipaagi sa ilong iadto din sa stomach and bahog na sila mga food na liquid ra pod. Then we have the nasogastric feeding tube. Mao ni siya nasogastric feeding. Orogastric tube insertion na wala na ko ni search na lang ninyo unsan siya ha. Then we have the gastric lavage stomach wash. Kani panglimpyo ra ni sa stomach nimo. Kusang daghay acid, daghay kuan, diha na siya ilimpyo kay para kuan pod oy kay baho pod mong stomach pod oy. Kailangan ni so maning gastric lavage, which is the stomach wash. So ang gastric lavage mo ning ang equipment niya na syringe, na kuan, wiring na ibutang stomach, na ay activated charcoal and na ay saline for irrigation malang mga hugaw mo na mo limpyo. So ang indications ani is that potentially life-threatening poisonous ingestion but only if the procedure can be performed within 60 minutes lang. So ang contraindication ani is that compromised airways protective reflex unless patient is intubated, ingestion of corrosive substance, acid or alkalis, ang hydrocarbons unless containing high toxic substance such as pesticides. There are known esophageal structures and history of gastric bypass surgery. And their complication naman is the trauma due to tube insertion, installation of lavage fluid into lungs, aspiration, the cardiac dipshythmias. Then we have the hypoxia, the laryngospasm, the fluid and electrolyte disturbance, and hypothermia. So what are their purpose? For urgent removal of ingested substance to decrease systematic absorption, to empty the stomach before endoscopic procedure, and to diagnose gastric hemorrhage and to arrest hemorrhage. Ano yung purpose niya? So the technique, gastric lavage, involves the passage of a tube via the mouth or nose down into the stomach, followed by sequential administration and removal of small volume of liquid. The placement of the tube in the stomach must be configured either by air insufflation while listening to the stomach, by pH testing a small amount of aspirates stomach's contents, or X-ray. This is to ensure the tube is not in the lungs. So the complication of it, the aspiration pneumonia while taking the unwanted poison and drugs out of the stomach lavage, the substance might accidentally enter the respiratory canal into the lungs and cause aspiration pneumonia. Then we have spasm, which uncontrolled and involuntary muscle contraction spasm of the larynx cord. And the hypoxia and hypercapnia, which lack of oxygen in the body tissue. So that's their complication. So we have going to the gastric analysis, which they are the basal gastric secretion test, which measures the fasting level of gastric production. The gastric secretion collected represents the amount of secretion during a 15-hour fast. 4, 15, or 30 minutes specimen are collected, and on each specimen, volume, pH, titrable acidity, and calculated acid output is determined. Maximal stimulation test, subcutaneous dose of histamine acid phosphate replaced by pentagastrin test, wherein pentagastrin is used to stimulate maximal secretion. Insulin-induced hypoglycemia test, which tests for the completeness of vagotomy. Then the hypoglycemia stimulates the vagus to stimulate gastric acid secretion within 2 hours after insulin injection. Then blood glucose measurement are also taken every 30 minutes pre and post insulin injection to make sure that glucose falls to 50 milligrams per deciliter or lower. So in the macroscopic, volume is 30 to 60 ml or 50 to 75 ml. The fasting contains few ml to 50 ml, average of 30 ml. So the specific gravity is 1.001 to 1.010, an average of 1.007. And the appearance or color in the normal, it is translucent pale gray and slightly viscous colorless with varying amount of mucus and food particles. Abnormalities in gastric fluid colors. Kung brownish red or coffee color, it means na naa siya presence of large amount of food. Kung opaque gray naman, pasabot na seen after test meal. Kung yellow naman, ang na siya presensya sa fresh bile. Kung greenish naman, na siya presence of karaan na bile or old bile. And red naman, na ay dugo di ay. Abnormalities in odor of gastric fluid. Ang normal it is odorless to slightly sour to pungent. O ang fecal odor naman is seen in intestinal obstruction or gastrocoholic fistula. Kung foul or putrid odor naman, seen in carcinoma ulcer. While alcoholic odor naman, seen in alcoholic coma or after alcoholic test meal. Kung ammoniacal odor naman, seen in uremia. Kung rancid odor naman, tungod ni siya to butyric or fatty acid in lactic acid present in sour milk, indicating stenosis and fermentation. So the pH reaction, kung normal, it is acidic to 1.6 and 1.8. Kung high acidity ra, 1.4 or lower. Kung low acidity ra po, 2.0 to 2.8. The pH reaction sa eochlorhydria refers to normal secretion with pH between 1.6 and 1.8. Kung hyperchlorhydria, increase free hydrochloric acid above normal around 60 ml, which are called peptic ulcers. Kung hypochlorhydria naman, it decreases the free hydrochloric acid, which carcinomas for the stomach, chronic gastritis, gastric syphilis. Then we have the aclohydria, the absence of chloride, which is the pernicious anemia, peladra, advanced gastric cancer. Then we have the chemical examination. Acid contents are of two types. We have the free hydrochloric acid, yung acid with a pH less than 3.5, at may naman yung mga combined hydrochloric or organic acid, yung mga acid na which combines with protein and protein-like sub to form protein salts of hydrochloric. Ganyan sila. So, sa test for free hydrochloric acid, we have the top first method, tubeless gastric analysis or the Diagnex Blue. We have Bawas method and Gansberg method. So, ang microscopic, the normal structure is that in the yeast cell, it is small amount. We have epithelial cell, we have starch granules, bacteria, lesser amount lang, and fat globules. Kung pathologic structures naman, the fragments of tissues, RBCs, yeast, large amount lang, we have pus cells, muscle fibers, large number of bacteria, sarcinae or Opler's bullous bacilli. And that's the end of our discussion.